Hi, I'm Martin. I'm team leader with the Meredith CERT. For those who don't know, Meredith CERT is the Meredith Community Emergency Response Team, and we're a group of local volunteers who are here to help in the event of an emergency. So when anybody in the Meredith or surrounding area calls 000 for an ambulance, the Meredith CERT get dispatched at the same time. So we can help with all sorts of time-critical emergencies, such as asthma attacks, cardiac arrest, anaphylaxis, hypoglycemia, but we're also here to help for less critical emergencies where we can offer pain relief, offer a bit of comfort, and generally get the patient ready for transport when the ambulance arrives. All of our equipment, including this awesome car, is provided by Ambulance Victoria. They provide our uniform, our supplies, our equipment, our medication, and obviously all of our comprehensive training. If you think you'd like to help, we're always looking for new volunteers, and so please reach out and contact me anytime. Okay, the reason we're here today is to talk about Restart a Heart Day. We know that every day in Victoria, 18 people suffer a cardiac arrest. 76% of cardiac arrests are in the home. 10% will survive an out-of-hospital cardiac arrest. However, if bystanders perform CPR and use an AED, survival rates increase by an incredible 72%. So what can you do to help in this situation? If someone is unconscious and not breathing properly, it's time to act. Seconds count. It's up to all of us to learn how to save a life in 3 simple steps. Call, push, shock.
Knowing CPR is one of the most important things you can do to look after your family and friends. That's because most cardiac arrests happen at home. And when bystanders like you take action, the survival rate doubles.
We know that CPR can seem scary or stressful, so we're going to talk you through how to do it in just a couple of minutes. Keep in mind that when you call 000, the call taker will tell you what to do and send us straight away. But knowing what to do before we arrive makes all the difference. With cardiac arrests, seconds count, and it's up to all of us to know what to do to save a life.
So, grab a pillow or a call, push, shock kit if you have one, and a space on the floor, and let's get started. Over to you, Jess.
When it comes to responding to a cardiac arrest, we can break it down into 3 simple steps: call, push, shock.
Okay, the first step is to recognise that when someone is unconscious and not breathing normally, they may be in cardiac arrest and you need to call 000 immediately. Cardiac arrest means the heart has stopped beating normally and immediate action is needed. So call 000, put it on loudspeaker, and the call taker will talk you through how to do CPR. They might ask you to check the patient's breathing, but at this point, the most important thing for you to do is to just call 000 immediately.
All right, the second step is to push. Push hard, push fast. And there's no need for you to do mouth to mouth anymore. Just use your hands. If there's someone else with you, take it in turns doing CPR. Swap every 2 minutes, as it's really tiring. You'll need to continue these compressions until we arrive and take over.
Here's a few things to keep in mind as you're doing compressions. Put the person on the floor if possible, not a couch or bed. Kneel next to their chest, with your knees about shoulder width apart. Put the heel of your hand in the middle of the chest, directly between the nipples. Place your other hand on top and lock your fingers together, like this. Try and keep your fingers off the chest. This will keep your weight on the right part of your hand. Lean over the chest with your arms straight and elbows locked. Push down 1/3 of the depth of the chest and let the chest rise back up before pushing down again. To get the right speed, you can use the song Staying Alive by the Bee Gees, or Row, Row, Row Your Boat, or even Baby Shark as a reference.
Basically, you want to be doing about 2 compressions per second. Join along with me. Row, row, row your boat gently down the stream.
Don't let fear get in the way. Try and stay calm. Do what you can, and remember that when it comes to CPR, any CPR is better than no CPR.
All right, we've covered how to call and push. Now let's tackle the shock component. When we say shock, we're talking about an AED or a defib machine.
AEDs are in a lot of shopping centres, schools and public places. Knowing where your nearest AED is super important.
There are many types of AEDs in the community. This is just one variety, but they're all just as easy to use. Just keep a lookout for this sign.
So, if you're nearby to one, or someone can grab one for you, here's what to do. Turn it on and follow the instructions. That's it. AEDs are totally safe for anyone to use. They analyse the patient's heart and only deliver a shock when needed. You don't need training to use one, and there's an automated voice that will tell you what to do. Some of the things it'll tell you are to remove their top,
Remove clothes from patient's chest.
where to put the pads,
Apply pads to patient's bare chest.
when to move away from the patient,
Shock advised. Stay clear of patient.
and when to keep doing compressions.
No shock advised. Begin CPR.
So there you have it. Call, push, shock. Call 000 immediately. Push hard and fast between the nipples and shock if an AED is available.
Remember, when you call 000, the call taker will tell you exactly what to do, and we'll be on our way as quickly as possible.
Thanks for joining Jess and me today to learn CPR and how to use an AED.
These are two of the most important things you can possibly do to keep your loved ones safe. Take care.
Thanks for watching that video. Hopefully you get the take-home message, which is there's no such thing as bad CPR, and when bystander CPR is performed, the chances of survival from a cardiac arrest increases by up to 72%. Now here in Meredith, we're lucky to have a public access defibrillator. So I'm in front of the community house here, and right on the wall in front of the community house, we've got a Zoll public access external automatic defibrillator. This one here is available to anybody to use 24 hours a day, 7 days a week. Having a community public access defibrillator is awesome, but getting as many people as possible to know when to use it is the critical part. For that, Ambulance have got a great initiative, which is the Good Sam Responder app. This is a smartphone app that's free to download, and you simply register your willingness to help in the event that someone near you is suffering a cardiac arrest. You need no prior training, just the ability to follow simple and clear instructions. When the 000 call taker are alerted to a cardiac arrest, the Good Sam system uses the location information from your phone to find the nearest responder. You then get an alert that you are nearby to an emergency. You have the option to accept or decline the call for help. Should you accept, you're advised where to find the nearest AED and the location of the patient. You can then perform CPR until backup from Ambulance Victoria arrives. You can find the Good Sam Responder app on Google Play or on the Apple Store. Okay, thank you so much for your attention. We really appreciate your time. We are now very happy to answer any of your questions. You can post them in the chat box or the comments section below. To help me answer the questions, I've got Dylan here. Dylan is a full-time paramedic based in Ballarat and our local senior team manager. In his role, he's responsible for looking after not only the Meredith CERT, but also the teams at Derreel and Blackwood too. Right, bye. Right. Okay, thanks everybody for watching that. Hope that wasn't too painful. Really appreciate your time. Has anybody got any questions? Put it in the comments underneath or in the chat box, and we will do our best to answer. I've got Dylan here, who's a paramedic from Ballarat.
Hi.
So we've got a little bit of a delay, so we'll hang here for just 30 seconds because it seems, depending on what your bandwidth is like and which internet you're with, you might be seeing this video about 10 seconds after everybody else. Oh, there we are. So there you are. There's a question for you there, Dylan. Why did we stop doing mouth to mouth?
Look, I think it's there's a couple of reasons for that. One of the obvious ones, obviously, is a significant infection control risk, and even more so in the current pandemic. The second reason is that the physiologists and doctors have worked out that when you press on a chest during CPR, as you release pressure from the chest, air is actually drawn into the lungs at the same time, which means that it's doing the same thing as mouth to mouth without actually doing mouth to mouth, if that makes sense. They're the basic two reasons for that one. I hope that answers your question, Sam.
Oh, we've clearly got a very satisfied audience.
I think so. Yeah, we've still got 9 there watching at the moment, so I'm hopeful for a few more questions.
So if you're out of phone reception, what's the best way to contact ambulance? That's always a tricky one, isn't it?
That's an incredibly tricky one, and to be honest with you, I couldn't accurately answer that one for you. I think you probably have to backtrack to the area where you last had reception. I think it's probably a good idea. If you are travelling into areas, perhaps camping, bike riding, those sorts of things, where there wasn't reception, it might be worth looking at alternatives for your communication if you're spending a long time in areas without phone reception.
There's a good one, Dylan. So what's the situation with CPR if the patient is a child?
It's exactly the same principle. So you'd follow that same process of cold push shock. And if the patient is unconscious and not breathing properly, you would do the same thing. If you go with a third of the chest depth when you're doing your chest compressions, I think that would probably likely keep you out of trouble. But the same principles apply. In children, even more important, really. Children are less tolerant to periods of not having good blood pressure or not breathing, and it can be more difficult to resuscitate a child. So I guess the principle there is exactly the same as an adult, and make sure you do it really, really quickly is the main thing. I hope that answers your question.
Yeah, and with the automatic defibrillators, like the one that's on the wall of the community house in Meredith, that one, when you first turn it on, it says adult patient selected, and there's a big button on the front which you press to change it to child mode, and then it says quite clearly child patient selected, and it just adjusts the amount of shock that it gives for the different size body.
And the machines, I think they have about a 99.9% accuracy, so they won't shock the child or the adult, whoever you attach the device to, where there isn't a shock required, and they're incredibly accurate. In fact, more accurate than humans are when determining whether the patient needs to be defibrillated or not. So that's a good little safety feature of the devices, and I guess that makes it, I suppose, a little bit less scary to put it on, knowing that the accuracy is about 99.98%, and you're not going to do any harm. I think the message really is that the harm happens if you don't take action at that point in time. And Martin, other than the AED at the community health centre are there any other AEDs in Meredith that are accessible to the public?
I know there's a couple privately owned ones that people have got where they've had a history in the family, but there's also one at the Rec Reserve. So the one at the Rec Reserve's available whenever there's an event on there. So during footy season and cricket season, that sort of thing, it's always available during a match, but it's behind locked doors for most of the time.
Oh yeah, no worries. And do you know where that is located when that building's accessible?
I'm afraid I don't know.
Okay. No worries. Yeah. It's interesting to know. A lot of communities have many defibrillators that aren't available all the time, but that one at the community health centre definitely is. All right. So we've got a question from Thomas. If performing CPR on the beach, should the patient face towards the water or away, or does it make no difference? I'm
guessing they're saying head uphill or head downhill is what they're trying to say with that.
Yeah. Look, the thing is, you should always have the patient supine on their back. I think if the patient's still in an area where it's quite saturated and wet underneath them, it's probably best to drag them up the beach to where the sand is dry, because obviously when you do defibrillate, that joulage or voltage can be conducted by the moisture in the water around the patient. So I guess in that situation, definitely have the patient on their back, but drag them up the beach to the closest point where the sand is nice and dry. And if you do have if the patient is still very wet, which they probably likely would be, there's probably going to be a towel around, particularly if it's in summer. Give the patient a dry down as well before you put the pads on, and that'll provide for better adhesion of the pads, but also it means that when the joulage or the voltage is delivered through those pads for the defibrillation, it means that the voltage will get to the heart where it's required. So I hope that answers your question. Not too much of an issue up around Meredith and Ballarat, but definitely down towards Geelong, absolutely. Yeah, it does happen from time to time.
Okay, there's another one, Dylan.
Okay. So, Thomas, no, you don't. And generally, more often than not, during CPR, regardless of whether or not it's bystander CPR or CPR inside or outside the hospital by paramedics, nurses or doctors, generally, more often than not, the patient will sustain some injury, whether or not it's to the skin or some fractured ribs. More often than not, these particular injuries are very minor in comparison to what else is going on with the cardiac arrest. But no, the shorter answer is you don't get in trouble for that. You're covered under what's called the Good Samaritan Act. So provided that your actions aren't malicious at that time, which clearly they wouldn't be if you're trying to resuscitate a patient. Definitely no issue if there were to be fractured ribs during that CPR resuscitation event. I think the thing is too, it goes without saying that CPR can be pretty brutal, but in saying that, it's again better to do it and resuscitate the patient than not, and avoid those sorts of injuries. So I hope that answers your question. So is it still suitable to use 2 fingers when doing CPR on a baby? Yes, is the answer to that one. So obviously, a baby in comparison to a small child large child or adult is really quite small. So doing CPR with the palm of your hand isn't going to work. It's obviously going to apply far too much force to that child's chest. So you can do 2 fingers is probably the easiest way for people in the community, and there is another method where you go around with 2 thumbs and push down. The 2-finger method is probably more easy, really. I think is probably the way to go. And again, 1/3 of the chest depth. So with babies, I think it's probably pertinent to add that babies, small children, right up into the teen years, generally more often than not, the causes of cardiac arrest aren't cardiac rhythms that need defibrillating. There'll be something else that's going on with that child. So again, really, really important to get that early CPR started. So I hope that answers your question.
That's fantastic.
Yeah, and then is there any situation where you wouldn't use a defib? In this situation, no. The only thing is if it was really, really unsafe. So things like there's a safety risk to you. So you certainly wouldn't do CPR or defibrillate a patient if it was, there was imminent harm going to be caused to you. Cardiac arrest in the middle of a busy highway, those sorts of things, for example. And the only other thing would be if you're using that particular device in an environment that's rich with flammable gases. So again, similar to when you use a defibrillator with in an environment where the patient is wet, you would remove the patient to an area that's dry. The same thing if you're if that patient had cardiac arrested in an environment that was rich with a flammable gas, you would if safe to do so, you would remove the patient from that area and then do your CPR and defibrillation from there. I think the thing is, if there's any imminent danger to yourself, things like unstable structures, it's on a busy road, there's flammable gases, anything like that, or you suspect there's a gas involved that you can't smell, and you don't know whether it's flammable or not. Again, they're the sort of situations where you've got to ask yourself, it's probably best not to actually do anything at that point for harm to yourself, but to wait for MFB, CFA and AV to come and assess the safety of the scene before we actually do anything. So I hope that answers your question.
Perfect. Have we got any more?
I don't know. Yeah.
Right, yeah. So while we're waiting, I'll just have a little bit more of a spiel on the Good Sam app and just really spruik the benefits of using that. And you absolutely don't need to have any prior medical training or even first aid training. You just have to be really willing to listen to the instructions given by the triple O call taker, who will sort of direct you to the location of the patient and where to find a defibrillator. And absolutely anybody can sign up for it, and you're always within your rights to get the accept or decline if it goes off at an inopportune moment. But certainly consider it. Just go to the App Store and download Good Sam Responder and have a look.
Yep. And I guess also too, if there's anyone that is still watching that is interested in becoming a first responder with Ambulance Victoria, you can register your interest on the Ambulance Victoria website to become part of a team at a location that's convenient to you. Obviously, we've got a first responder team in Meredith that Martin heads up, and we're always on the search for volunteers to join up. You're provided with a certificate too in pre-hospital care, a formal qualification which can lead on to other opportunities in emergency care as well. So it's a really, really good opportunity if that's something that you're interested in. So Sam, question here: the old rule 30-2. Now that there is no mouth to mouth, do we just keep going the whole time? Yep, absolutely. We just keep going the whole time. We're safe to do so for yourself. So focusing on ratios and rates of CPR per minute, obviously the evidence suggested that it probably wasn't making any difference, if not making it a little bit more complicated than it had to be. So yeah, it is literally just keep going. Yep.
Perfect. And there's a question there from Thomas as well, saying that can you buy your own defibrillator? Absolutely, you can. St John's is probably the obvious one. I know they stock a range of them, and also the supplies. And also it's worth noting, if you have your own defibrillator and you use it as a good SAM responder, ambulance pay for any replacement parts that you would need to put to get it back in action again after you've used it on an ambulance call.
Yeah, absolutely. And I think there's, the prices are coming down now that it's a more common piece of technology, and it's proven to be very, very safe to use these devices. And I think, there's a lot of people with cardiac issues that, might go traveling and take one with them. So yeah, definitely can get them.
Well, that's been a great session. I think if there's no more questions coming in, we'll give it another 30 seconds or so just to see if there's any bit of a time lag. But otherwise, we'll let people get back to their Saturday night. And thank you so much, everybody, for bothering to take the time to watch. And hopefully it's been interesting and useful.
Yeah, and thanks very much. And again, I hope you learned something and stay safe. And take care.
Okay, I think that'll. Oh, you've got one more. Oh, good. Yeah, you're welcome, Thomas. Thanks. I reckon.